Look, if your clinic isn't growing the way that you want, this video is for you. Most clinic owners think that they need more leads, more ads, more SEO, more social media, or just like a better marketing agency. But in reality, a lot of clinics are already getting enough opportunities. And don't get me wrong, marketing matters. You need demand, or you need people to know that you exist. But what I realized after scaling our own clinic and then helping other clinic owners do the exact same thing is that the quickest way to grow most clinics is not always with more new leads. It's by increasing the conversion of the patients who are already coming through your doors. Now, if you're a startup or you're getting 0 patients coming in through your door, it's a completely different story, right? You need some inflow of patients. You need an influx of patients. But once you have that influx, you need to maximize the in-office systems before you spend another dollar on marketing. And this is where a lot of clinics leak so much money, both from the marketing side and not converting patient side. There are clinics right now spending thousands, multiple thousands of dollars every single month on marketing, ads, SEO, social media, marketing agencies. But when the patient actually comes in, the clinic is leaking money at every single step. From the phone call to the patient journey to the treatment presentation to the follow-up, there are gaps everywhere, right? And then the dentist sits there thinking, we need more leads. But come on, you don't need more leads if you're losing the ones you already have. Even if you're existing patients, right? Your existing patients that need treatment, those are leads. So in this video, I want to break down what I call the patient conversion system. This is the system that helps clinics scale to 7 figures and beyond. Not just because more patients are coming in, right? But because more of the right patients are agreeing to your treatment plans. They're showing up, they're accepting treatment, and most importantly, they're coming back, they're referring, and they're staying with you for life. And then the cycle continues on and on and on again. If you want to run an effective business and a great clinic, you need to understand what happens from the second a patient discovers you to the moment they say yes to your treatment. And even after that, there's lots of pieces. If any part of that journey is broken or sucks, your growth is going to be limited. So the first part, number 1 of the patient conversion system is the first impression. And most clinic owners massively underestimate this. Your first impression is not when the patient sits in the chair, right? It's not when the doctor comes in and you meet the doctor. I've talked about this time and time again. The first impression usually happens way before that. It happens when the patient sees your website, your Instagram, your Google reviews, your photos, your videos, and your overall online presence. That is when they first judge your clinic. And that is where most of clinics or majority of clinics lose a huge percentage of potential patients before they even speak to them. Dentists really underestimate how much content patients consume. Let me tell you a story. I had a patient yesterday, a sweet 80-year-old lady, telling me that she watches all of my YouTube videos on her laptop and loved my recent ones on veneers. So no, you're not just making content or videos for the younger generation. Everyone is online nowadays, even 80-year-olds. At the very minimum, making good content is going to increase your authority. And that is the thing dentists sometimes forget. Patients do not look at your clinic like dentists do. They're not analyzing your margins or asking what implant system you use or what scanner you have. They're not looking at things like that. What they're looking at is, does this place look clean? Does this doctor seem reputable? Does the team look friendly? Do I trust these people? This is why your online presence has to match the level of dentistry that you are trying to deliver, not backwards. You cannot be doing multiple 5-figure treatment plans with dark case photos, a confusing old website, generic stock images, and a homepage that looks like it hasn't been updated since 2016, right? It just doesn't work, not anymore. Your first job is to create trust before the patient ever meets you guys. Your reviews need to show real patient emotion, not just great dentist 5 stars. Your photos need to look professional, or not even professional. They just need to match the context of what you do. Your website needs to explain outcomes, not just list procedures. And that is conversion step number 1. Number 2, the second part, is the inquiry, okay? The patient reaches out. Maybe they call, maybe they send a message. And most clinics treat that inquiry like an admin task, right? But it's not an admin task. Not only an admin task. It's a human being raising their hand up saying, I need help, right? In whatever shape or form. Someone may be embarrassed about their smile. They might be in pain. They might be scared because they haven't been to the dentist in 8 years. If all your phone call is a talk, get them on the schedule system, then just hire an overseas caller. Why do you even need someone taking phone calls in the office at that point and paying them much more? You can't have patients contact your clinic and get a cold, rushed, robotic response. They're not better than a robot. That is how clinics lose patients. Like I said, at that point, just hire an AI calling service or an overseas individual for a fraction of the cost if you're going to run your clinic that way. The last thing you want is your front desk to be like, Hey, how much is Invisalign? Oh, our Invisalign starts from X. Would you like to book a consultation? Just off the top of my head, a better response can be, of course, I can help you with that. Just so I can guide you properly, are you mainly looking to fix your front teeth, fix bite issues, or is there something else that's bothering you? Now, you're not just throwing a price at them. You're having an actual conversation. And the same thing applies to implants. If someone says, how much is an implant? Most clinics panic, right? Because they just assume the person is price shopping. Sometimes they literally just do not know what else to ask other than the price. They don't know the difference between an implant or a crown or veneers or bridge or really anything. So if your team just gives them a number, you reduce the entire conversation to a number, to price. Instead, you want to educate them. You want to guide them. You want to listen, most importantly, to what they're not telling you. And this is why team training matters so much. Your team is not just answering phones or messages. They're not robots. They're shaping the patient's first emotional experience with the clinic. They're building the first layer of trust. And if that part is weak, everything else after is going to become harder. Number 3, the third part of the patient conversion system is the new patient experience. This is what happens when they actually arrive, right? Again, this is where a lot of clinics treat this like, let's run through an exam and get on to the next patient. Let's see more new patients. They think the patient doesn't care about their experience. But what leads to higher conversion rates and whatever you recommend is how they were greeted, how the team interacted with them, whether their experience felt organized or felt different from other offices, and so many other little things. Most patients are already slightly uncomfortable walking into any dental clinic, right? Even if they're not terrified of the dentist, it's still not exactly their favorite place to be. Nothing pleasurable, if we like it or not, comes from a dental office. 95% of dental procedures are not fun. So your job is to remove friction. The easiest way to do that is to create a new patient experience flow. Your patients are going to remember how the clinic made them feel. They should never feel like they're navigating your office alone, right? Or they're in a dental factory. Even in a nice looking office, by the way, it can feel like a dental factory. Just because you've updated your office or you're modern, it doesn't mean anything if the experience sucks. And then number 4, the fourth part. The fourth part is diagnosis and treatment conversation. This is where a lot of dentists accidentally lose patients. Even though their diagnosis may be correct, you know what's going on, you know what to recommend to the patient, but you explain dentistry like a dentist. And because the dentist does most of the talking, not the team, not the patient, think about it. A patient does not wake up in the morning excited to buy an implant or abutment, a crown, or fillings, and periotherapy, or any other clinical procedure for that matter. They care about not being in pain, avoiding future issues, smiling more often, eating normally again, and so on. Your team and you have to connect the treatment to the outcome. Now, let's say John comes in with a missing tooth, a few cavities, some gum disease, okay? And he has been chewing mostly on the right side for months. The normal dental version is we need to do an implant here, we need to do fillings here, we need to do SRP, and we're gonna monitor this area. One example of a better delivery is, John, based on what we're seeing today, the main goal is to get you eating comfortably on both sides, stop these cavities from turning into bigger problems, and get your gums healthier so we're not just patching things up every few months. You can either keep treating things one by one, which is fine as they become urgent, or we can put together a proper plan to get your mouth stable into a healthy place. How does that sound? That is a completely different conversation, right? Now the patient understands the why. They understand the bigger picture of why you're recommending this. And this is not about pushing treatment, by the way. It's about showing the patient the full picture. And a lot of clinics only treat urgent things, or they let the patient dictate what they want, not actually what needs to happen. Sometimes it makes sense in the moment, but if that becomes the standard of the clinic, you end up training patients to only come in when something hurts. You train them to think in emergencies. Okay, now the fifth part. The fifth part of the patient conversion system is the handoff. And this is one of the most underestimated parts of the entire patient journey. It needs to happen from the very beginning to the very end, from treatment coordinator to assistant to doctor, doctor to treatment coordinator. The patient should feel guided and listen through the entire way. They should never have to repeat anything because your team is on top of it. A strong handoff should feel like a continuation of care, smooth. Instead of saying, Sarah will help you now at the end of the appointment, you, the doctor, are going to say, Sarah, this is John. We spoke today about getting him out of pain on the right side. We spoke about replacing the missing tooth so he can chew properly again on both sides and putting together a plan so John is not constantly dealing with one problem after another. He did mention, by the way, he's a little bit concerned about the timing and the costs. So can you walk him through the options and make it really clear for him? Now the treatment coordinator has context and the patient sees that your team is aligned. Nothing is going to make a patient feel more like a number than having to repeat their story to like 4 different people, or things getting lost once it gets into finances, or realizing they don't even care about X procedure. And nothing makes a clinic feel more premium than everybody already knowing what's going on and communicating with each other. The sixth part is the financial conversation. This is where many clinics either they become awkward or too aggressive. The patient should understand what they need, why they need it, what the options are, and what happens if they delay, and how they can move forward. You do not want the patient leaving confused from your office. If John hears a big number and does not fully understand the value behind it, of course he's going to be confused or not assign any value behind the big number. A financial conversation in your office should not feel like, here's the price, here's the line items, do you want to book? It should feel like, here's the plan that we discussed, here's what this solves for you, why it's important for you. Here are the phases, here are the options, here are what we will prioritize first, and here's how we can make it manageable. A good treatment plan coordinator knows how to do this. Seventh part is the follow-up. Honestly, this might be the easiest money most clinics are leaving on the table. A patient comes in, gets a treatment plan and says, I need to think about it, and then nothing happens. Maybe you're going to call them once or going to send them a voicemail or text message, and then the clinic moves on until the patient maybe reminds you, even though the patient has unscheduled treatment sitting there. They already know you. They already had the diagnosis from you. They already had some level of trust. And most clinics just let them disappear and then they focus on new leads. This is insane when you really think about it, right? You're going to pay for new leads, but you will not properly follow up with someone who's already come into the clinic, already needs the treatment, okay? The follow-up system does not need to be complicated, but there should be a clear process for following up with unscheduled treatment. Good follow-up is mandatory. It's not an option. You should be showing care for the patient. How important is your treatment plan if you present it and then you never follow up, right? It doesn't communicate importance at all. If someone has an issue in their mouth and you know by delaying it, it could get worse, why would you not follow up? You're not bothering them. You're doing your job. And from a business perspective, this is where huge growth can happen without increasing marketing spend. Because a lot of the revenue that you're looking for is already inside your office, already inside the pipeline. And then number 8, the 8th part is retention and referrals. This is what turns a good clinic into a compounding business. Circular. If every patient is a one-time transaction, you need to constantly keep getting new patients just to keep the business alive. And that is exhausting. You're gonna be like a hamster. But if the patients stay, refer, bring their family, leave reviews, come back for more treatment, and trust your office long-term, your growth is gonna become so much more easier. That is created by the entire experience that you set. What makes patients loyal is how they felt through the process in your office, and that is what creates loyalty. When I say patient conversion system, what I'm not talking about is some sales script. What I am talking about is building a clinic where every step of the patient journey increases trust and the likability of your clinic. And this is what actually scales. The mistake a lot of clinic owners make is they're trying to fix one part in isolation. They think that we need better marketing, or we need a better receptionist, or we need to do better case presentation. And yes, maybe you do need all of them, but the real power comes from making the entire system work together. Every single step matters. And this is why I always tell clinic owners to audit the patient journey. Literally, walk through your patient journey like a patient. Go through your website and try to book an appointment. Listen to how your team explains things. Look at your reviews, your photos, your follow-up, your handoffs in the office. Go through all of it, your treatment presentations and your financial conversations that your treatment coordinators, whoever are having, okay? So if I had to summarize the whole thing, it would be this. To scale a dental clinic to 7 figures and beyond, you need to stop thinking only about how to get more patients and start thinking about how to convert, serve, and retain the patients you already have coming through your door. When that system is built properly, growth is just gonna naturally happen. That is when you start to build a real business. And this is exactly what we help clinic owners do at Clinical Climb. We look at your clinic from the outside, audit the patient journey, find the leaks, and show you what needs to be fixed for your unique situation so you can scale without constantly feeling like you need to work more, spend more, or just like add more things to the business. By the way, we're doing free audits again, where we sit down and actually look at what is happening inside your clinic, where you are, what you're doing well, what needs to improve, and what you should prioritize if you want to scale properly, if that's your goal. If you want that, just send me a DM on Instagram with the word audit at Dr. Chris Bano. Until then, I'll see you in the next one.